Good afternoon, everybody. Welcome to our medical cannabis meeting. I think we've got a lot of exciting news to share with you guys, and I'm excited that the commissioners and our staff have the opportunity to do that this afternoon. So, I'd first of all like to say welcome to the members of the commission, the audience, everybody that's here, that's watching the streaming today. Delegate Morheim is here, and also is Katie Wunderlich from the Deputy Legislative Office of Governor Hogan. So, welcome everyone. I'd like to say thank you to the University of Maryland, the medical student teaching facility, for all their assistance setting up the meeting here today and all their IT assistance. I think it's important to recognize that Katie Wunderlich is closely monitoring legislative initiatives related to health issues for the governor, and we ask Katie to extend our warm wishes to the governor for a speedy recovery. I'm also happy to announce the appointment of Shannon Moore as our newest commissioner. Welcome, Shannon. As you know, HB 490 added a new position to the commission. Ms. Moore will serve as a representative member of the public as a patient supporter. Ms. Moore helped found the Maryland parent group Stop the Seizures and the National Parents Coalition for Rescheduling Medical Cannabis, which advocates for children who would benefit from medical cannabis. She is the mother of two twins with a life-limiting form of epilepsy known as Miller-Dieker syndrome. Ms. Moore also manages the Office of Sustainability and Environmental Resources for Frederick County Government. She holds a master's degree in environmental science and management from the University of California, Santa Barbara. Sounds like a nice place to study. Ms. Moore, would you like to say a few words?
Is my microphone on? Yeah. I'm really excited to be doing this. I had a difficult decision to make because, as you know, with having twins with a life-limiting condition, you're pretty busy, but there's a lot of things in my life that I can't control. And one of the things that I've found that I really enjoy that makes me feel very hopeful is helping to provide access to medical cannabis to people who truly need it. I've been very involved in it in the past couple of years at both the state and federal levels. I've also worked with a lot of people in other states. And so I'm hoping that I can bring to this an understanding of what has made other state programs successful and unsuccessful, both on behalf of those people who are most direly in need of medical cannabis, but also in terms of creating a favorable business environment so that they can have access to good product. So thank you so much for having me. I'm really glad to be here.
Thank you. I'd also like to extend a welcome to Brett Felter from the Department of Health and Mental Hygiene, Assistant General Attorney. Brett is filling in for, on an interim basis as counsel to the Commission pending the hiring of a new full-time assistant attorney, hopefully sometime in September. And as a reminder to the commissioners, get your smartphones out. September 3rd, we have a commission retreat. Location to be determined. Now it's time for the commissioners to introduce themselves. I'll introduce myself, Paul Davis. I was elected as a physician representative and appointed chair by the governor. I'd like to point out that if I slur during this commission meeting today, I had a root canal this morning. This is my second root canal of the day. No. I'm very honored to be at the University of Maryland Medical School. When I was a medical student, we used to discuss marijuana a lot, but it was never in the context of our patients. So on that note, I would like to ask Dr. Michael Horberg to introduce himself, and we'll go around in a clockwise direction.
Thank you, Dr. Davies. I'm Michael Horberg, another physician representative. I'm the Executive Director for Research, Community Benefit, and Medicaid Strategy for the Medical Group for Kaiser Permanente.
I'm Robert Lavin. Can you hear me? I'm Robert Lavin. I'm also a physician. I'm Director of the Chronic Pain Management Clinic at Baltimore VA, and I'm also on staff here at the University of Maryland.
Good afternoon. Thank you all for coming. I'm Dr. Nancy Rosencone, and I'm not a real doctor, PhD. I'm the Executive Director of the National Council on Alcoholism and Drug Dependence.
Hi, I'm Allison Taylor, Director of the Office of Governmental Affairs at the Department of Health and Mental Hygiene, and I'm here representing Secretary Van Mitchell.
I'm Shannon Moore.
I'm Dario Broccolino, State's Attorney from Howard County and representing the Maryland State's Attorneys.
Tina Paul, expert horticulturist.
John Tronfeld, representing University of Maryland Extension.
Dr. William Chris Charles, PharmD, went to school just across the street, so I've been in this building multiple times. It's a little bit of a homecoming. I'm the Transitions of Care Coordinator at Sinai Hospital and was nominated by the Maryland Pharmacists Association to represent pharmacists.
John Gottschalk, representing the State Comptroller's Office.
I'm Eric Sterling. I'm an attorney with experience in medical marijuana issues.
Debbie Mirren, representing patients.
By Rob Shaw, Chief of Police in Cheverly, representing law enforcement.
And Hannah Byron, the Executive Director of the Commission.
Thank you, everyone. I'd like to take a second to ask for a motion to approve the meeting minutes from April 22nd, 2015.
I make a motion.
Do I have a second? Any further discussion? Those in favor? Aye. Any nays? All right, motion carried. Thank you for approving those minutes. Now I would like to introduce Commissioner Eric Sterling, who, by the way, just introduced himself, so I don't really need to introduce him. He'll be presenting a PowerPoint presentation entitled Medical Cannabis in Maryland. The staff has developed a presentation for any member of the Commission who might be asked to present on the subject of medical marijuana. Commissioner Sterling has presented this to a number of organizations at different venues, most recently at a senior living community center in Howard County, where there was an overwhelming positive response both from the residents of that community center and the community's coordinator. I'd also like to mention that Commissioner Miriam and Commissioner Charles have also used the presentation at the Pharmacy Association annual meeting. And now I will direct you to Eric Sterling. Sir, would you please go ahead and share this demonstration with everyone?
Thank you, Mr. Chairman. So this is, friends, really just merely a template for the convenience of commissioners who may be asked by the executive director to represent the commission in different kinds of audiences. And naturally it would be modified for any particular audience so that it's most appropriate for it. I begin with a disclaimer that at this point the regulations are not yet adopted formally. There may, God bless you, there may be changes. The application process is not final, and for my comments in these slides are only informational. And please then don't rely upon these as an authoritative statement of the law or the regulations, and if you're applying for a license, please consult your lawyer. So the background for the commission is first that there has been critical leadership by key delegates in the House of Delegates, Dr. Dan Morheim and Cheryl Glenn, and Senator Jamie Raskin over numerous years, numerous sessions of the General Assembly to bring the legislation to conclusion. The commission was created in 2013 by a law signed by Governor O'Malley. It puts the commission in the Department of Health and Mental Hygiene to carry out the medical cannabis law. The program was expanded by the General Assembly both in 2014 and 2015. If you go to the online version of the Health General article where it appears, the last time I looked, that had not yet been updated to reflect all of the changes in the law that were enacted in 2015. The Commission's job is to develop the policies and the regulations to implement the program. There are 16 members. You heard them introduced this afternoon. The chair is appointed by the governor. The regulations have been in development since December 2013. We've had numerous opportunities for public input at many meetings that we've held, and the opportunity for written submissions on several different rounds. Most recently, then, the regulations were just published on June 26th, and they remain open right now for public comment until July 27. You can go to our commission website to get the address to which you can send your comments, and they're available to be reviewed on the commission website. Following the necessary steps, we expect the regulations will become effective in September. As an overview of those who are being licensed, the regulations detail that we're going to oversee growers. Initially, by state law, there will be 15 licensed growers. They're also eligible to operate a dispensary. The growers can be located anywhere in the state. The legislation wants there to be geographic diversity in the issuance of the licenses. There are also licensed processors who can convert the leaf and flowers into extracts or into medications more directly, like ointments or lotions or otherwise. At this point, the regulations do not authorize making medical cannabis directly into food-like products. People can certainly use extracts in baking. They can use them at home to prepare food products, but we didn't have the time in order to try to get a form of regulations available into enactment and into effect to get our growers and our dispensaries up. We didn't have the time to begin the much more cumbersome process of figuring out the details of regulating food-like products in a way that we felt would be adequate to protect the public safety. And then there are the dispensaries. There would be 2 licensed dispensaries per state senatorial district, which would be in addition to the dispensaries that any licensed grower might have. There are 47 state senatorial districts, and that would mean then, at this point initially, 94 dispensaries. Applicants may apply to more than one state senatorial district. Imagine sort of applying to college. You might apply to a half a dozen colleges, but you're only going to be able to go to one. And so if your application is the top application in one of the 6 senatorial districts, then that would be a place where you likely sort of would be able to open a dispensary. If you're 3rd or 4th ranked in another senatorial district, it may be that the top applicant there is opening in a different senatorial district. And so your opportunity to be in that, where you're ranked 3rd or 4th, might arise in a senatorial district where you have also applied. But you're only going to have one dispensary. Very important part of our process is to have independent testing laboratories to inspect all the products, all the leaf, all of the flower, all of the processed products, to assure that they meet the specifications prior to their release to the patient population. We detail in the regulations a lot of the things that we expect growers to do. We want their premises to be secure. We want there to be strict control to production. There need to be standard operating procedures so that the staff know what they're doing. The commission staff, our professional staff, will be trained and qualified to inspect the growers to see that they're complying with the regulations and with the representations they made about what they were going to do in their applications that we approve. Each batch will be tested. There are strict inventory control requirements. Dispensaries, similarly, strict security and control requirements, packaging requirements, labeling requirements. A feature of the Maryland law is that dispensaries may deliver directly to patients. And we spell out how that's supposed to take place. We will encourage patient education by dispensaries. The cannabis that is obtained will be recorded in the Commission database, and a key feature of this is to make available to doctors a precise statement of the medication that their patients have obtained. Because every lot and batch number will be analyzed, a physician will be able to know my patient obtained so many grams of this particular lot with a cannabinoid profile of the following, and I see this is how my patient is progressing, and I can make a connection then between that and the cannabinoid profile. There is a requirement that adverse events be reported by anybody who becomes aware of them, whether it's a dispensary, a patient, a physician. There are fees. One unique feature, perhaps, of this program is that it is not paid for by the taxpayers. This is not a taxpayer-funded project. It's paid for by the fees that are charged to get a license, and of course, therefore, the patients themselves ultimately are paying these fees in terms of what the costs are that the medication is going to cost. The employees of the growers, the processors, the dispensary agents, the owners, the managers, all of them will need to be registered with the Commission. They have a $200 annual fee. The laboratories have a $100 registration. The employees of the laboratories must register. Our plan for license application is that anticipating that the regulations are finalized in April, that very soon thereafter the applications and the instructions to apply will be released. We anticipate that there will be something like a 45-day period in which applicants can prepare and submit their application by the deadline. Applications will then be reviewed and ranked according to the public rubric by an independent review team that the Commission will select. We're anticipating that getting back to the reviews and rankings, we anticipate the Commission will be voting to issue licenses by the end of 2015. After the licenses are approved, and if you look into the regulations, you see that there's a two-step process. The pre-approval gives you then an authority to move forward, but is not a license to begin to operate. So you're going to have to capitalize. You're going to have to obtain your real estate, hire your staff, train your staff, and then you come to the Commission a second time and say, we want to be inspected. We want you to come and check out our physical plant, check out that we know what we're doing, then check out that we've obtained proper zoning and planning requirements that have been met. Then you get a license. Then you can commence operations. Then growers can begin to sort of produce medicine. Patients. Patients register with the Commission. We want to establish the identity of our patients. They'll obtain a registration number. The General Assembly asked the Commission to establish a 30-day supply for a written certification. Our team, led by our pharmacists and others, then concluded that 120 grams of usable cannabis or 36 grams of Delta-9 THC in infused products would constitute a 30-day supply. The dispensary is going to track each dispensation. Now, 120 grams is a quantity that's unlikely to be picked up on one day by a particular patient. And so over a number of acquisitions, this is designed to keep track of that so that before the 30 days expire, somebody can't go up above the 120 grams. But the law has been also modified to note, the regulations have been modified to note that physicians may, in extraordinary circumstances, say that this 30-day supply is inadequate for this patient's treatment of the condition and may modify the written certification to reflect that. The patient must have a bona fide physician-patient relationship, which is defined. There's no charge to patients. Patients are not required to have identification cards. If they request one, there's a fee. Certifying physicians must register with the Commission. There is no charge. There's no fee for a physician to register. We anticipate it's going to be a registration online at the Commission website. Physicians must have a Maryland license to practice medicine that is active unrestricted and in good standing, and they must have a registration to prescribe controlled dangerous substances in Maryland. The general physician registration is to register to treat a patient who has a condition that is severe, for which other medical treatments have been ineffective, and for which symptoms can reasonably be expected to be relieved by the medical use of cannabis. The General Assembly was very concerned to encourage the registration of physicians to treat certain conditions. So we're encouraging physicians to register to treat chronic and debilitating diseases or conditions which cause cachexia, anorexia, wasting syndrome, severe or chronic pain, severe nausea, seizures, severe or persistent muscle spasm, glaucoma, or post-traumatic stress disorder. So again, a bona fide physician-patient relationship, and I'm sure many of us sort of know what these entails. It's a treatment or counseling relationship. The physician has reviewed relevant medical records regarding the patient, completes an in-person assessment of the patient's history and condition, creates and maintains records in accord with medically accepted standards, and there's an expectation that the physician is going to monitor patient progress and is going to take action if necessary. Physician examines the patient must be registered, and the law requires that the physician establish inclusion criteria, setting out what are the kinds of patients they're going to treat. So someone with a certain kind of expertise in a certain practice of medicine is not going to be treating patients whose conditions are outside their expertise. And similarly, there may be grounds on which a patient might be excluded. One that occurs to me would be that there's evidence that the patient is diverting the cannabis and not using it. And if a physician who suspects that a patient is doing that would be within his or her rights to exclude the patient from further care. So once then all this has taken place, the physician makes a determination that the potential benefits of medical use of cannabis are likely to outweigh the health risk for the patient. This leads us then to the issuance of the written certification. Again, this is going to be handled through the Commission website. Physician will issue the written certification by logging onto our website, providing the usual kinds of identification data, specifying the condition that's involved. If the patient requests a printout of the written certification can be made at that time. There's no charge for issuing written certifications, and in extraordinary cases, the physician may issue a certification that says that the 30-day supply can be exceeded. The law provides for caregivers. Patients designate the caregivers. They must be 21, and this would be for persons who can help them administer or obtain the cannabis. Caregivers must register with the Commission, establish their identity. They must obtain an identification card. They can't be a caregiver for more than 5, and they have to attest that they understand the various restrictions. Patient goes to the dispensary, obtains an amount. So at that time, the dispensary must check the identification of the patient, then go to the Commission website to determine that the patient has been issued a written certification, check to see how much cannabis has already been issued to this patient under the 30-day written certification, and then may dispense and record the batch and lot number of what's dispensed. The General Assembly is extremely concerned about diversion. So any person who might possess or distribute diverted cannabis faces up to 5 years in prison. We have, for street marijuana, illegal marijuana, decriminalization in Maryland. So possession of a very small amount of marijuana in Maryland might get you a $100 fine, but here, if you possess the same amount of medical cannabis that's been diverted, you go to prison for 5 years. And these are penalties in addition to whatever the criminal law penalties might be. This is the location for the Commission's website. We welcome your email, your questions. When we get certain kinds of questions that seem to us to be the kind that ought to be frequently asked questions that others might see, on our website we have a number of frequently asked questions. Thank you very much. We're happy to take your questions. Thank you. And that would be questions in the presentation. I'm not taking questions now. Thank you.
Thanks for the clarification. I thought we could have been here for the next 2 hours, at least. Okay, thank you, Eric. That was a great presentation. I'm sure Eric would appreciate anybody's feedback after the meeting. Now I would like to introduce our Executive Director, Hannah Byron. She is going to give us a very exciting, informative update of a lot of things that have gone on in the last few months.
There you go. Okay. Thank you very much. Good afternoon, everyone. Thank you for coming. Thank you to those that are streaming. We appreciate it. This is a great turnout. And always thank the commissioners for all of the help that you've given me over the last 6 months. I really couldn't do it without you. And I just thank so much for your support. So since our last meeting on April 22nd, the Commission and the staff have been extremely productive. First, the Medical Cannabis Commission's website at mmcc.maryland.gov has been extensively built out. If you haven't gone to see it recently, I would suggest you take a look. The additions include the development and posting of a timeline with a proposed implementation schedule for each element of the medical cannabis program, including FAQs specifically tailored for patients and caregivers, physicians, and potential grower, processors, and dispensary applicants. For physicians, information about medical cannabis training programs has been posted. Commissioner Debbie Marin is going to talk about that a little bit in her report. And I would like to thank Ben Steffen and Dave Mitchell for their ongoing support of our website. On the regulatory front, as Eric mentioned, the Commission published new proposed regulations on June 28th in the Maryland Registry. This has incorporated many of the thoughtful recommendations from many of you, from over 50 public comments that we received, and the period for public comment on the new draft regulations ends on July 27th. Once the comment period has concluded and pending completion through DHMH review, it is anticipated that the regulations will be finalized in early September. Also an update on our IT system. As you know, I have been working over the last 6 months with the members of DHMH IT team to develop the online registries for patient caregivers and physicians that Eric just spoke about. Sundar, do you want to come on up? I would like to, oh, there he is. I would like to thank Charles Lehman, Phil Hemler, Sundar Bakumar, Jim Johnson, Mary Feely, Andrea Kolakowski, and Gerald Spence. These folks have been an amazing lifeline for me on the IT systems, and their invaluable experience and information, technology-related matters. We have the very best team. We're so fortunate to be able to work with you right in the Department of Health and Mental Hygiene. So what I thought I would do is just show you very briefly. This is in beta testing, but the registries that Eric mentioned, and if we could, Sundar, go ahead, and we'll just start with the patient registry. This would be the main database where people would come, and so we'll start with the patient. The patient will click to register, the basic information, address, phone number, demographic information. There will be, we will require current photograph for those that want to have an ID. This will be a very secure website, and all of the information will be secured. So this is where they would first register. Enter their username and password. They will be given a 2025 number, patient ID number. If they do request an ID card, again, it's not required, but this would be the information that they would need to submit in order to get that. And if there's a lost or stolen card, there is a renewal process as well. This is where they can look at their physician certification and print their certification. Takes a little bit of time to load this. Again, it'll have their patient number, it'll have their certification number, their qualification date, their expiration date, physician's name, some other demographic information, and physician information, the conditions for which they've been approved to receive the medical cannabis. Caregivers, again, Eric talked about caregivers are required to have an ID, and they're required to register on the database. And so again, this would be the information that they would need to provide. And there's also I believe, Sundar, the click for the minor information. Oh, see, that's me. We used me as the test for the photo. So under that, you will be able to pay by Visa or MasterCard. And then if you do have a minor patient, there will be a minor patient form that you would need to download and fill out. And the caregiver will be able to update their profile if, for instance, they no longer have a patient or they are going to add another patient. So again, this would be information that they would have for their patients that they are caregivers for, and they will also get a unique identification number. Okay, for physicians, again, Eric went over some basic information. The physician must be in good standing. We would need to have the information on their license number and also their license number for controlled substance, and some other information in terms of what they are qualified to administer or to. I mean, there's a check-all, which I guess there could be some doctors that could oversee some of these conditions. I would think glaucoma and PTSD would be separate. Again, some attestations that they would need to check. And then this would be, their certifications. And again, the patient number would be required, some other demographic information, the condition for which the medical cannabis is being certified for, and if the patient, Eric mentioned, in some extreme situations, if a patient requires more than 120 grams, they would have to include why. We're going to be watching that, obviously. And see, that was a way to stop right there. There will be the error flags in case there isn't certain information that we require. They won't be able to go any further. So again, these could be the certifications that a physician has certified, and there's also, they can revoke a certification. And then this would be the form that they would fill out. And if they want to renew the certification, there would be the renewal process as well. So, very brief overview, but we wanted you to be aware that this is in the works. We're going to be ready to have these registries. We're hoping for. Thank you, Sundar. Thank you very much. I want to give Sundar a big one. I can't tell you the amount of hours that go into producing the work that's been done here. We're so grateful. So there will be, additional information for once after Stage 1 of the application. Stage 2, there will be information for the processors and dispensaries and growers that will also be included. But we will talk about those at another time. So we're very excited about this. We're hoping that we'll be able to get the physician registry up first, and then we will work to get the patient registry up. We do want to be careful not to create this huge anticipation. If we don't have the medicine ready, we want to make sure that we get the patients' registries up when they know that it's eminent. So we'll look at the physicians first, and then the patients and caregivers. Okay. Do I just need to push a button here? Sorry. Great. And if any of the commissioners want to, at some point, go further, deeper into this, happy to meet with you and go over it in more detail. But this is really just sort of the first steps. Okay. They don't want to give me my agenda. That's okay. There we go. So, let's see, what else? I wanted to give an update also on the applications. The commissioners have been just terrific with their work in the development of the applications. We've been working in teams for the processing, dispensing, and grower applications. I have an announcement that I would like to make. We have engaged the services of the Regional Economic and Studies Institute, or RESI. It's a unit of Towson University's Division of Innovation and Applied Research to help develop application language and assist in managing the professional evaluation of applicants seeking licensure as medical cannabis growers, processors, or dispensaries within the state. RESI has extensive experience with state agencies, nonprofit organizations, and private sector firms to provide superior economic policy and program analysis, and is comprised of a team of highly skilled professionals, including analysts and researchers. Working with RESI will enable the Commission to move forward on the application development and evaluation process by tapping into a network of industry experts nationwide. The Commission anticipates application and instructions for prospective growers, processors, and dispensers will be available on the Commission's website in September. And it is anticipated that once the applications are posted on the Commission's website and the evaluation process is complete, the licensees could receive Stage 1 approval as early as December of this year. Compliance update. Eric also touched on compliance. As per the regulations, once the applicant has received a Stage 1 license pre-approval, the Commission will conduct inspections of all proposed premises to ensure that all the premises conform to the specifications presented in the initial application and meet regulatory requirements. To that end, the Commission will be engaging with the compliance inspectors in association with the Americans for Safe Access. ASA will provide trained compliance agents, and we will also provide training to Commission compliance staff. Investigative services. Also, as required by the regulations, all individuals identified in grower, processing, and dispensary applications will be subject to criminal history background checks through the CJIS, the Criminal Justice Information System, and the FBI. We will be inviting bids for professional services for an independent contractor to perform the background investigations for individuals identified in the regulations associated with applications for medical cannabis growers, processors, or dispensary licenses. And these reviews will then be provided to RESI as part of the application review. And I just would like to thank Gary Goldberg for his breadth of experience in state government procurement and support in the development of the proposal. And just a few other announcements. I understand the Maryland Cannabis Industry Association is working with some interested partners in the development of a one-day symposium for physician training in the fall. So stay tuned for that. It will be focused on physicians. And I am very pleased to announce that the organization Patients Out of Time will be hosting their national clinical conference on cannabis here in Maryland, in Baltimore, from April 14th through the 16th in 2016, which is just going to be great timing for us. Patients Out of Time was founded in 1995 to support patients by educating healthcare professionals, patients, caregivers, and the public about the therapeutic cannabis. So it's wonderful to be able to have them here. Their conference last spring in Palm Springs had over 600 attendees. Eric Sterling attended. Eric came back to me and said, I really think we should try and host this group in Maryland. So we went after that, and we were very pleased that they accepted. Their board of directors approved them to be here. So we'll be in touch with you about that. But that's a wonderful thing for us here in Maryland. I think the timing's going to be great. And then finally, we are reaching out to the hospital grand rounds coordinators to ascertain their interest in having presentations over the fall and winter, and I will keep you informed on this outreach. So in conclusion, I just would like to thank the hard work of my small but mighty staff, Mary Jo Mather and Precious Wells, and to once again thank each and every commissioner for your invaluable time and expertise as the commission navigates the final steps to meet our common goal to make medical cannabis available to Marylanders who so desperately need it. So I thank you very much, and I look forward to continuing to keep you apprised on these matters.
Thank you, Hannah. I can't thank you, your work, your staff's work, Commissioner Sterling, Commissioner Mirren, and all the other commissioners who have been so engaged over the last 3 months. Everything that you see in front of you has taken a lot of work, and everybody has been very committed to doing that. To get this conference, Patients Out of Time, to Maryland for the first time ever, I just think is an amazing achievement, and it's just the start of Maryland going on the map as being the most responsible, greatest medical cannabis state in the country.
Yeah, Dan, can you, Delegate Moorheim?
Yeah, Delegate Moorheim, would you like to come up and say a few words?
I'm just here to introduce you, Delegate.
Carry on then, Deb.
Well, I like that slide that had my name on it. Hi, everybody. Eric Sterling, thank you for a sterling report. And thank you all commission members for taking this such a long way. I'm Delegate Dan Moorheim. This is my, been elected 6 times, and so this is my 21st year in the Maryland General Assembly. But this bill goes back to 1980, when Delegate Wade Katz first put the bill in. And Dr. Davies, thank you for starting by introducing Shannon Moore, because when we go through all this stuff, and Debbie Mirren, you have to remember it's really about the patients. And as a practicing physician, and I am a practicing physician, I will be working tomorrow in the emergency room from 4 p.m. to 11 p.m. at night. I'm well aware of the patient aspects of this. So thank you all for coming. It's great to see such a big turnout. It was kind of lonely in the years before. We didn't have crowds coming out for medical cannabis, but I'm glad so many people are here. But let's remember that the patient issue is what drives this. And thank you, Commission, for working so hard on this. It's really exciting to see the progress. And I just renewed my medical license. And Hannah, your form for applying, if I should so choose, which I probably won't, but if I do, it was very simple and straightforward, exactly as it should be. So let me just make a couple of points. I also want to thank some other people. Former Delegate Bob Costa is here. He was very instrumental. It's been a bipartisan effort from the beginning. Delegate Cheryl Glenn has done an outstanding job. I want to thank Governor Hogan and Secretary Mitchell, and represented here today by Allison Taylor. They really contributed to House Bill 490 in a positive way. We had a lot of challenging issues, and their active participation made a good bill much better, and their input is really appreciated. I also want to acknowledge way in the back, and I know she won't like this, Erin Hopwood, the Health and Government Operations Committee drafter, who did a lot of work on the bill, because in the end we don't pass concepts, we pass words, and somebody's got to put it all together and have it hang together and make sense. Erin, thank you again. The landscape will continue to change, and I expect there will be regulatory and or legislative changes every year or every few years as we go forth. The federal landscape is changing. They've just removed some barriers to research. Even Congressman Andy Harris, who was opposed to this along the way, has now acknowledged that research is important. There was just Louisiana just passed medical cannabis. Passed by the legislature, signed by the governor. I don't think their program is really going to work, but neither did ours in the first pass. But the fact that they moved in that direction tells you that this is a phenomena that is happening. And there's interesting data. Just yesterday there was a report from Israel where most of the primary cannabis research has been done, that it helps with healing bone fractures. Who would have thought that? I've asked my library to get me the actual study, because I only read the news article, but I will be sending that information to the Commission, and that may be a use that I don't think I anticipated, nobody I know anticipated, but it's a peer-reviewed published study, and so we'll learn about that. A couple of things about this bill that I think are also helpful, because having been involved with this legislation actively for a long time, I really appreciate that in the legislation and in the process that you've outlined, we have data collection. That's really going to be important for physicians and others to know. We also need to figure out ways to include dentists, nurse practitioners, pharmacists, and podiatrists, other potential active professionals involved in this. In fact, when I put in the bill a number of years ago, the dispensaries were to be pharmacies. But unfortunately we couldn't do that because of federal legislation. But there are ways that we need to look at that as we go down the road. A couple of other issues. Banking issues need to be addressed. A lot of people have talked about that, and the money part of this, my prime interest is as a clinician, but the money part of this is going to need to figure out some way how to flow that's responsible, not in violation of banking law. We don't want a cash business. We want the workers to be working in a safe environment, getting paid properly with proper deductions and taxes and workers' compensation. I know the comptroller is going to be working on that, but that's not in their department exactly, but we'll be trying to work with the state banking authorities on how that best can be done, because we want this to be a legitimate business. It is a legitimate business. Eric touched on the local issues. A number of people have contacted me about local issues. Local zoning is up to them, but I would go back to a couple of his slides, and what I've told in my district in Baltimore County, and what I've told the county people who have talked to me about this, this should be treated like any other business. The regulatory scheme, the background checks, the security, the accountability from beginning to end. The counties don't need, local zoning, local entities do not need to add anything to that. This is highly well regulated by the state. The Commission's done a good job. So when you're going to talk to your local county people who may have some concerns, they have not followed this issue as well or as closely, tell them this is highly regulated by the state. Otherwise it wouldn't have passed in the Maryland General Assembly every year for the last 3 years with overwhelming bipartisan votes, and by overwhelming of 188 legislators in the House and Senate, somewhere on the order of 175 to 10 or 178 to 6. So this bill is long past any political controversy at the state level, and if legislators did have all these concerns that you might imagine they have from across the political spectrum, the legislation was very consciously driven, and I think the regulatory process that you've done has been created to answer those questions. Last thing, I think. This all boils down, you can have the finest growing facility, the most sophisticated processing, and the greatest dispensary, but this boils down to physicians writing recommendations. It's not a retail operation. I was talking to a friend of mine who's a physician, and he said, so the physicians really haven't focused in on this, not because they don't know about cannabis or not because they're not interested, but quite frankly because our rules in the past were too onerous. Figured this just isn't happening, I'm busy, why should I pay attention? Now the physician community is coming around, and I want to acknowledge Gene Ransom, the president of MedChi, State Medical Society back there. MedChi's been a strong supporter of this bill. endorsed the bill from the beginning, as did the Maryland Nurses Association. So the physicians and nurses, the frontline clinicians, have been supporting this for a long time. And I'm trying out there, and I'm happy to work with others to talk to doctors. I am a practicing clinician. I am a board-certified physician. I do a lot of things. I'm also on the faculty at the Hopkins School of Public Health. And we need to let the physician community know that this is coming. Patients are going to be asking, time for you to be aware. And I was, again, so impressed how easy it will be to sign on. It's exactly as it should be. Physicians practice, learn new drugs all the time. That's part of what I'd have to do. And this shouldn't be any different than that. So let's see here. I think that's it. Thank you very much for giving me a few minutes. Thank you all for coming out. Let's make the program work.
Thank you, Delegate Morheim. Deb, Commissioner Mirren, how about that educational report now?
Okay, thank you, Delegate. That was a great introduction to me because what I want to focus on for a few minutes is physician education. We are ready now. And if you visited our website, under the Physicians tab, we have added some courses that we have looked at or well-respected members of this cannabis community have looked at, and we feel very confident offer a great introduction to the endocannabinoid system, basic science, some practical clinical advice, some dosing and pharmacology information. And along with these come CME credits, so physicians that need to fulfill those will also have the added benefit of making some of their annual requirements met. So I just want to mention a couple of them specifically. The Society for Cannabis Clinicians, many of you may know this society. It is a physician organization. Our chairman has just recently joined as a member. We are very excited to have him as a member, which allows us access to some of the good work that the society does. They partnered with the clinical cannabis medicinal curriculum and the Medical Cannabis Institute, and they offer a course that is about a 12-part series for which there's a CME credit per course, so this is very extensive, and the link to that is on our website, and an overview of all the topics can be found there. We also added a resource page that the Society published that we thought was extremely helpful, in addition to the course they offer, so it keeps you up to date with some of the things that we were following, which are conferences. The one that was just recently held in Nova Scotia. There's an international conference of clinicians in the Italian Riviera in September, if anybody has free time in September. So they track all of this, so we thought it was important to list that. They also have links to other ongoing continuing ed classes that we've also looked at, so we were happy to see that they had included a link to the University of Arizona, which Dr. Lavin had specifically mentioned to us as being one that he had looked at. They also have the link to the University of Washington continuing ed class, and we have that one specifically referenced as well. So I would, and then last but not least, I think that we were going to have a guest speaker here today, Stephen Korn with the answer page, and he wasn't able to make it, but we have also included the link to the answer page. And he, if you're familiar with his curriculum, he worked with the Massachusetts Medical Society to prepare training for the state of Massachusetts, which has a mandatory physician requirement training, unlike what we have here, which is optional. But we thought that his program was very well done, and so we have included a link there. And once again, his course is also carries with it continuing education and CME credits, so that those could be met. He also plans on some major updates in the next couple weeks, next couple of months, which will include education not only for just physicians, but patients and caregivers also. So those will all be accessible through his link that we've included. Last 2 points, just following up from last month's or last quarter's meeting. A couple of members of the commission, along with Hannah and staff, we met with the FDA. We had mentioned that we were going to meet with them, and we did, and we had a wonderful meeting. It was scheduled for an hour, and we finally were kicked out of the room after an hour and a half, and neither party really wanted to leave. 14 members of the FDA attended the meeting. and they were great listeners and great note-takers, and they shared a lot with us. And I think that going forward, we all realize that the FDA knows what's going on at the state level. They're keeping a very close watch, and they were very pleased, I think, to hear that our focus is on standardization and quality, both at the manufacturing level and then carrying on into testing. And they were very pleased to listen to the details of some of the requirements that we will have here. So that was a great meeting, and we plan an ongoing relationship with them, so I'm sure we will be meeting with them again. And then also, Hannah and Eric both mentioned the frequently asked questions. We will be updating those as needed. There are a good number now, but we know as questions come into the staff, and once they're repeated 2 or 3 or 10 times, we get the idea that maybe we need to answer some more. So as you have issues and we keep track of those, we will be adding FAQs as is appropriate. So I think that's it for education. Thank you, everybody.
Thank you, Deb. Any new business? No new business? Then I'd just like to point out that our next meeting is tentatively scheduled for October 27th, and we are most likely going to call a meeting in December that is not scheduled as yet. We will be reaching out for dates on that meeting. Then going into 2016, January 26th and April 26th will be the meetings in the first quarter. Before I call for an adjournment, I would just like to thank Gene Ranson for his hard work with the physician community. It is a very important part of our outreach. If we, as Delegate Morheim said, if we don't have the physicians on board, we don't have a program. So thank you, Gene, for that. And equally important, I want to thank everybody here. Having worked with you guys over the last few years, it's just great to be around such an amazing, responsible group of individuals. I never thought it would ever work out like this, and thank you for making my job anything but a root canal. Thank you.
Chairman, I move to adjourn.
Do I have a second?
I second.
Okay, the meeting is adjourned at 3:09 p.m. Thank you, everyone. Have a great summer.